It's another Friday, and you know what we do every Friday at this time is our Glaucoma Awareness Program, made possible by a collaboration with the Eye Specialist Hospital. Good morning, dear listeners, and welcome to Glaucoma on Radio here on Solid 100.9 FM. Today, we're shining a light on the aging eyes. As we grow older, our bodies change in many ways. But one area we often overlook is our vision. The truth is, aging increases the risk of vision problems, and one of the most serious of these problems is glaucoma. You may think you're taking good care of your health, but the eyes need special attention as we age. Early detection and proper care can make all the difference between clear vision and irreversible loss. To help us understand this, we have with us a consultant ophthalmologist, Dr. Obinna Shiwobi, who will walk us through the link between aging and glaucoma and how we can protect our eyes even as we grow older. Growing older we must, but then what do we do with this precious gift that is our sight? Thank you, Dr. Obinna, for joining us this morning.
Thank you. Good morning, our people. Dalun Day Wono.
Okay, I'd like us to start the conversation with understanding the basics. So, Dr. Obinna, can you explain what changes typically happen to the eyes as we age?
Okay, just first and foremost, it's good to always start with appreciation. Thanking Solid FM for this privilege, this social responsibility to our people, bringing this to our people every Friday. We know glaucoma is the commonest cause of irreversible blindness in the world, in Africa, in Nigeria. And, we keep saying studies have shown that it is more among the blacks. And from studies, we've known and established that it's more in West Africa. And the Nigerian blindness and low vision survey, it was commonest among the Igbos. We found out it is in our genes. So, glaucoma is something we cannot shy away from. It's the commonest cause of irreversible blindness. And very importantly, its early symptoms. Its symptoms come late by the time it becomes advanced. Now, to your question, aging, like you said, is what we all pray for, what we all plan to get to. And we're not in control, as we age, but we're in control in some way, So aging affects the eyes, just like aging affects every part of the body, As it pertains to glaucoma, yes, it does affect glaucoma. Now, somebody will ask, does aging cause glaucoma? No, it does not cause glaucoma. But it's a risk factor for glaucoma. Glaucoma has been found to be more among the elderly than the younger ones. That is from the age of 60 and above. As you grow older, the prevalence of glaucoma, increases as one ages. And above the age of 60, for every decade, it doubles. So, glaucoma and aging are 5 and 6, Like I said, not everybody who ages will have glaucoma, no. Like I said, it's a risk factor. It does not cause glaucoma, but it's a risk factor. Maybe when we come to the basics, we'll now know why it will affect glaucoma. Not only increase the prevalence of glaucoma, but the prevalence of almost eye condition.
Okay. All right. While you were talking, I felt that some people who are not yet old will say, well, it doesn't concern me, it concerns those who are old. But something tells me that what you will experience in old age is a summation of all you've been doing or not doing to your eyes. You might want to talk on that.
Yes. Thank you so much. I think you're the one who is the resource person today. You're doing a wonderful job. Now, glaucoma affects every age, from a child born today to a 100-year-old individual. It can affect every age, but it's commonest among the age of 50 and above, 60 and above, as the age grows older. And there are reasons for that, and then we should all know that glaucoma comes, as one ages, there's a balance between intraocular pressure, the fluid that keeps the eye, turgid, strong, the way it is, solid the way it is. And it's called the aqueous fluid, So there's a balance between production of this fluid and drainage, That's balance, because it brings in nutrients to the transparent part of the eyeball, which includes the cornea and the lens and other parts of the body, upper parts of the eye. So it brings nutrients and also drains, and that also removes things that are maybe toxic to the eye. So it brings and then it drains. Now that drainage angle is actually what in most time is implicated in cause of glaucoma. Now, once the production of the aqueous fluid is constant, remains constant, then the drainage, once it reduces, it increases the pressure of the eyes. Now, it can come from many factors. One, as one grows older, the lens of the eye also enlarges. Because the lens keeps growing all through one's life, So the lens fibers are laid to the lens nucleus all through the life. So as one ages, the lens also increases in size, and the lens bulges forward, pushes the iris lens diaphragm forward, reducing the drainage angle. So there's normal drainage, but there's there's normal production, but there's reduced drainage. This will increase the intraocular pressure, and this pressure also sends back signals to the optic nerve, trying to destroy it. Now, on its own too, with aging too, the anterior chamber angle where these fluids drain also narrows too, Also, as one grows older, the flexibility of the lens, of the anterior chamber, also becomes kind of rigid, no longer flexible to, allow more drainage of fluids. All this will increase intraocular pressure. And one factor we know about glaucoma is the raised intraocular pressure. So this is actually what would actually be destroying the optic nerve, causing glaucoma.
All right, that's interesting, and that also means that as you get older, you have to be very careful about, your eyes.
Yes.
Okay, so are there things like early warning signs of glaucoma that aging individuals should pay attention to?
Yes, sir.
Especially knowing that glaucoma itself doesn't present early signs. Yeah.
So, once you begin to have blurry of vision, it appears as if there is harmattan. The weather is smoky, and you feel that this is not clear, and you go wash your face, then something is wrong. Now, when you notice that you're unable to see what you usually see before, people will greet you from afar. Then usually you used to see them at that distance, but no, you're no longer seeing them until they come close to you. And then you see that you are now bumping into objects, as tables, seats, as if you are not seeing them. These are really, really warning signs. Now, for primary angle closure glaucomas, they may begin to have pain, but usually the angle closure, the open angle, there's no pain. So they begin to have intermittent pains, When they begin to have such pains, and they begin to see colors around lights. You wake up in the morning, you see colors around lights, blue lights, what we call halos. The medical term is halos, As if there's rainbow lights around light, then something is warning that the pressure is actually high. So there are once you begin to feel that your vision is no longer what it used to be, please come. It's just an early warning sign.
Okay. And I hope we can apply some of these things. So now let's look at prevention and lifestyle. Beyond regular eye checks, what lifestyle habits can help older adults protect their eyes? And let me also add another one. When we say adults, of course, it starts from 18, but
yes.
when should someone really begin to take this thing more seriously? At what age?
Okay. At the age of 18 is good for everyone. Annual checkup.
Okay.
Now, for those with family history, once the person can walk, he can start. You lose nothing letting a child come, because children also come down with glaucoma. You need to see, and then the one big risk factor is that there's a family risk factor. It runs in family. So once there's a family history of glaucoma, one needs to start coming annually. Annual checkup does not kill anybody. So you come, and then as you grow older, you should become very, very cautious of your ocular health. You should make yourself more available for eye checkups. You can do annual, Then, but for those with family history, and as you grow older, I can even do every 6 months.
Okay.
So that they might say a joto to natural woji.
Okay. So let's talk about, is there any relationship with what we eat, our nutrition, to maintaining good eye health as we grow older?
Yes, we've talked about this before, and then we've discussed about basic things as per fruits, leafy vegetables. We've talked about them having antioxidants that protect the eyes. We've talked about them nourishing the optic nerve. We talked about them nourishing almost the retina, almost every part of the eye. So we have always talked about leafy vegetables being useful to our people. We have also talked about people avoiding caffeine and not well processed cassava. When we say it, some people take offense, because we all love abacha. It's our delicacy. But as our people, when the person who does the abacha has so much requests, so much business requests, they tend to shorten the process. And that fermentation process is necessary to remove the cyanide content of the cassava. And this cyanide content we know is causes optic nerve neuropathy, affects the optic nerve. So we advise for those who have advanced glaucoma, if you can stop, it's okay, and then, or you are sure of the where your source comes from, as far it is well processed, that the cyanide content of the cassava has been removed. That's the essence of the fermentation process, so that these cyanide contents are removed before consumption. So we've talked about caffeine, and being not toxic to the optic nerve. So this we've discussed this earlier, and then people can eat food, but we are also against all these processed foods. We say go with natural foods, natural yam, and then the other one. I mean, all these processed foods. So there's no, you can't have anything against fruits and vegetables. Leafy vegetables, apples, and let me not say apples. Let me go with our oranges. What is common to buying. Oranges, cucumbers. At least we're beginning to produce cucumbers now. And which makes a lot of sense. Not only for the eye, but also for the general health. So the leafy vegetables, rather than our people sell their leafy vegetables and buy processed foods, I don't want to mention names, it's good they feed their children with those ones, because their health is more protected when they take in natural foods than the processed foods. So in that case, it makes a lot of sense for our people to realize that these vegetables that you see that we commonize, are actually healthier than the processed foods that people crave for.
Okay. Let me ask this question. I once visited a doctor to look at my eyes, and then they could not get the correct estimates because of the presence of diabetes.
Mm-hmm.
So I want to ask, what is the relationship between sugar, blood sugar,
Mm-hmm.
and my eyes?
Yes, okay. Now, diabetes on its own is becoming a very big risk factor for blindness.
Okay.
Diabetes affects the eyes. Now, it's now a risk factor for glaucoma. Not that it doesn't cause glaucoma. Now, one important factor about these two, diabetes and glaucoma, is aging. Do you understand? Is aging. So people tend to, as you're diagnosing as one with diabetes, frequents hospital for evaluation and management. Now, that same person, also complains. Now, we have known, it's established that diabetes affects vision. When the sugar in the body, the glucose, what we call hyperglycemia, once there's hyperglycemia, the lens tend to absorb water. And when they absorb water, they increase in size, increasing the refractive index of the eye. Now, for somebody who is already wearing glasses, you see that your glasses is no longer working. And you come to hospital to say, I will ask you, are you diabetic? You said yes, and we'll check your sugar. You have been on medication, you find out that sugar is actually not well controlled. Nobody will give you glasses with a raised sugar or hyperglycemia.
Okay.
I'm using sugar for our people to understand what I mean. So once your sugar is high, nobody, no ophthalmologist, no optometrist should give you glasses. It shows how it affects the eyes. So for you to give glasses, the sugar must be within normal.
Okay.
Many times, give a week. Don't just, how people do it. They do their best to put this, all this while sugar has been high. Then because they're coming to see the doctor in 2-3 days time, they become very strict. Begin to fast, begin to do so many things so that when that day, the sugar will seem to be normal. No, that is deceitful, So we ask them, okay, put it down, write the sugar on daily basis as you check it, so that we'll take a look and see. We want it at least a week, 2 weeks stable within normal before I can give you. So, and as per its relationship with glaucoma, it affects glaucoma in so many ways. It also weakens I've talked about. It also causes cataract. And with that cataract, there's also a movement of the left iris diaphragm forward. It also we can also weaken the trabecular meshwork where this thing is drained, where the aqueous flow is drained. So diabetes, is a big risk factor currently for glaucoma, and it also affects the vessels of the eyes, because in some quarters we are considering the glaucoma to be also a vascular, has a vascular component. So these are risk factors that will make the diabetic eye more susceptible to glaucoma than one who has no diabetes.
Wow. That means the sugar has to be controlled before.
Yes, sugar must be well controlled. I think our people should realize that diabetes is not a death sentence. Diabetes is something people can control. The most important thing is that it requires discipline, and then follow your physician's orders, and then it is not managed by chemists. It is only managed well by medical doctors.
Okay.
I think our people should realize this, the issue of doing herbal drinks and everything. Now, yes, those things may help, but we want to be sure of what we are doing. We want to be sure that you give this and this is the result. And this can be the consequences of that thing you have given. Not that you do things blindly. You know, I don't know my approaches are people more here. You know, it doesn't make sense.
Okay, you mentioned cataract. Are there other eye conditions that are related to aging that people should not confuse with glaucoma?
Yes, very good. You mentioned cataracts. Now, cataracts and glaucomas are causes of painless, progressive diminution of vision. You know, let me say painless, progressive. I don't want to use the word loss as if it has lost, but it's a depreciating vision. You know, it keeps getting worse over the years. Now, the other one is what we call age-related macular degeneration. You know, the commonest cause there is aging. You also have the vein occlusions, the central vein occlusion, the hemi-retinal vein occlusion, the branch retinal vein occlusions. And the commonest factor, the most important factor is aging too. You know, and then glaucoma is also a risk factor for that vein occlusive disorder. You know, so you can see how much aging plays a role, you know, with the nerve and the vein and the artery in the eyes have the same sheet, that is, they have the same covering. And as one ages, the artery becomes strong, as the vessel becomes stronger, what we call sclerosis, it becomes sclerotic, you don't understand? Or we call atherosclerosis. So, and because they share the same adventitial sheet, the same covering, with aging, the artery that is now hardened, you know, let me say layman word, hardened, impedes on that nerve, because the artery brings in blood, oxygen, nutrients, the vein drains out, you know, waste. Now, because they share the same sheet, because one is now thickened and hardened, it can now impede the drainage of blood, and then causing occlusive tendencies. So this, because the drainage is no longer adequate, it begins to cause into the eye, bleeding into the eyes. You know, and this also causes this is the commonest cause of, is a cause of a sudden diminution of vision. So aging, we know, plays a role in almost eye ocular condition. And like a vehicle that one bought now, you know, or buys now, such a vehicle is sound, but over the years, you know, every part may begin to depreciate. Not all at the same time, but you know, it will no longer be the same. So same thing with the human body, you know, and then same thing with the eyes. You know, as you grow older, the tissues of the eyes begin to also age, and at that time they require tender, loving care. You know, the aging person needs to have more eye checkups, you know, so that we make sure that he is in good health and does not come down with any of the causes of diminution of vision. You know, whichever one that comes, like things like cataract, you can't prevent them. You know, if they come, you take them out. If it's glaucoma, you do the needful. If it's age macular degeneration, you also do the needful. You know, so aging, like you asked, can cause, you know, a lot of eye conditions. You know, so, and that's the people who come down with, when the younger ones talk about inability to see distance, mostly refractive errors. You know, but for aging, for the aged, it is mostly one of these pathologies. You know, commonest cataract, followed by glaucoma, age-related macular degeneration, the vein occlusive tendencies, and so on and so forth. So,
How in order is it to? There are people who try to counter age, who try to reverse age, Of course, aging is a natural tendency,
Yes.
and sometimes is inevitable. But there are people who believe. What's the position of science in terms of reversing age, and does it reverse the consequences that come with aging?
No, it's obviously not possible. Is Uncle Yusuf is like asking, can science stop death? Hmm?
Hmm.
We have already agreed that now, na ọnwụ zuru Igbo,
Hmm.
you know, ọnwụ amaghị enyi, you know. Same thing with aging. I mean, yes, the only thing we can do is to do those things that are positive, those things that we know protects our health. We've talked about eating well, you know, the vegetables, the natural foods. We've talked about exercise earlier on this program, how it helps, you know, that people should keep fit. And then, you know, like one who loves his car, and make sure that this car is well maintained, you know, you go and remove the oil, make sure that it's serviced. You also service the body. No, osisi ahụ na-amịta mkpụrụ ọma also needs to be serviced. You know, so our people should also realize this and do the needful. So it has, well, science is trying to help, but stopping the aging body is not well, that's all I'm doing, but it doesn't seem real, because the natural body will always be the natural body.
Okay.
You know, we're not what do we call them again? We're not what is what do you call these things that behave robots? We're not robots, you know. We are humans, and we age, and for every aging it takes a toll, you know. My best were not white before, but now before I didn't even have any. Now some years I had. Now, you know, now they're not turning white. I mean,
But there are people who look quite younger than their age.
yeah, because they do one. It could be genetic. Do you understand? You can see somebody who is 40 looking older than somebody who is 50. Now, many things can be attributed to it. One is eating well. Two, somebody who is health conscious. Three, exercise. Four, regular checkups. You know. Five, trying to be in the best of mood. You know, not trying to carry the whole world on your head. You know. And then six, you also pray that the person has a good gene. You know, longevity runs in also in families too. You know, so. That's what our people can do. These are basic things that people can do, and this is why you see people getting involved in exercise, trying to eat well, you know, and then try to control your how will I put it? Not let me say, try to be disciplined about what you eat, about what you see. You know, not everything that looks good, like confectionaries, you know, that's are healthier. You know, we should also be quite. We should also make every effort to make sure that whatever we do is for the good of the body and the good of the being.
Okay, just before we open up the talk lines, I wouldn't be surprised if there are people who go to places where they are prayed for so that they can reverse aging or live long, or you know. These are people who probably will not go for checkups,
Yes.
who will not want to even know the condition, who will want to maybe use positive confessions to stop aging. Okay, some can even quote scriptures that your strength will be renewed like that of a eagle. For them, it means that they will not age.
Yeah, but you see, your point is valid, and in our present day Nigeria, it makes a lot of sense. You know, our people do not understand the scriptures, neither do they understand Christianity or the faith they profess. You know, I ask people, you want to go to Nsukka from Enugu, you stay in your room, pray, then go board a vehicle and go to Nsukka. Now, if you remain in your room praying and you don't leave that room to go and board the vehicle, you remain there. You know, our people should just use their senses. I don't think people are applying things wrongly. You know, like I remember what I saw somebody posted yesterday He said a woman needed a cesarean section to have her baby. What a woman needs to is not to be pregnant, and then secondly to have a baby normally, so that the woman comes out, the baby comes out. That's what the man wants. Now he said no, she must be like the women of Hebrew. And then they've told you that this passage cannot allow this baby come out, and you insist. So same thing with what you just said. And people should realize this. The Bible says onyekwe chiyekwe. We say heaven help those who help themselves. God, who has placed medical health for our own good, God also placed transport for our own good. He also placed this medium for us to create our proper awareness. God, in his wisdom, has done all these things. So for people to deny what God has put in place for their good means that they actually do not understand the powers of God and the omnipotence of God. And they don't understand that God has put all these things for their own good, and then not trying to deceive themselves. So I think our people should realize this. If you pray, also do the right thing. Like I said, it's like going for exams. Those who read their books are also praying. Those who don't read their books and pray are not praying.
Okay.
But that is the truth. So our people should realize this. So the person who goes for checkups, those who seek proper checkup, are those who actually want to be well, and that is what God wants from us all. We shouldn't just realize that this thing, we shouldn't deceive ourselves, that God has put these things in place for our own good and not otherwise.
Now, Africa seems to be a continent of people who believe so much in superstition. So we've tackled those on the extreme right that express a blind optimism. But on the far extreme left, we also have people who assume that poor vision is just a natural part of aging, that there's nothing you can do about it, and so there's no point going to the hospital. How do you respond to
Yeah, okay, so like
extreme?
you said, at the extremes, they're also wrong in the sense that they can be helped. They can be helped to see better. They can be helped not to be visually impaired. They can be helped not to go blind. The biggest annoyance is going blind for preventable diseases. Now primary glaucoma may not be preventable, but the consequences, the complications like visual impairment and blindness are preventable. So our people should also realize this. That don't say no okenye. No, we know, but come to the hospital and be well assessed. So they'll tell you, oh papa, you may need glasses to improve your vision, both for reading and for distance. For those who get to the age of 40, those who find that they are unable to read prints, they need to come to hospital, to be given proper aid to allow them read. For those who use computers on the system, and they have discomfort, they find it difficult to, they're always having some aches, and discomfort. So they should also need to come get something to help themselves so that they can read comfortably. You cannot do away if you're already using systems, computers, laptops. I mean, you can't do away with them. How do you feed yourself? So, but you can get yourself, medical help, aids that will ensure that you do things the same thing you were doing before, but it became discomforting. It can now become comfortable for you to do them again. Then you find out you're unable to read, you do the needful. You don't say okay, and then so what? So that means you'll be unable to read, and you're a lecturer, you're a lawyer, you are a professional or a secretary. Why will you not be able to read again when it's a simple spectacles could help you read? And now we also know, when we talked about one of the early symptoms of glaucoma, it can also be finding it difficult to read prints. And that's why those who come to hospital have advantage, and those who just go to the market and then they begin to do try and lock, because then the doctor will be able to tell you, it's just pure presbyopia. so they give the glasses for reading. Or no, something sinister is happening. It's beyond just presbyopia. This could be this is glaucomatous, So then that has been a warning sign, and that saves you from going blind or becoming visually impaired. So to those at the extreme left, do the needful so that you don't succumb to disease conditions. I tell people that don't allow disease to defeat you. You should always defeat the disease. You are diabetic, and so what? Do the needful. You'll be okay. You live a normal life without your lifespan going down. You're hypertensive. Do the needful. See the right people. See the cardiologist. They will help you. Diabetes. See the endocrinologist. The physicians. They will help you. So also, for those who are visually challenged, see the ophthalmologist. They will help you. So our people should know that. Just like the same people, see where the argument is faulty. If assuming they bought a new car, and the car becomes faulty, when they take it to the mechanic, would they say, that's the usual thing,
And I think the analogy is apt. The older a car is, the more likely it will depreciate in quality. So what do? Keep upgrading it.
Upgrade it.
All right, welcome back. The talk lines are open. 0909-771-1009. You can also dial 0704-550-2840. I'll take the numbers again. You can ask your questions. You can make a contribution. 0704-550-2840 or 0909-771-1009. Let's get your input. Hello, good morning.
Hello, sir. Good morning, sir.
Yeah, good morning.
I'm Mr. Ene from Coast River State.
Okay, go ahead.
I'm also a glaucoma patient.
Okay.
I've been in this condition for over 10 years today. So I want to ask, and although I've undergone surgery and I've been taking my medication, but my vision is keeping on dropping. And although the reason why I called it, I want to ask, what are the implications of a glaucoma patient to take alcohol and caffeine? Those are the areas I want to go. And how do one know that vision pressure is high on its own? That's my question.
Okay, so you want to take alcohol and forget about your Surabi?
No, I want to know, as in the implication of a glaucoma patient to take alcohol.
All right, Dr. Obinna, let's.
Okay, Mr. Ene, good morning. We've talked about alcohol consumption. Is linked to a high risk and progression of glaucoma, as well as it also increases intraocular pressure. Particularly if there's a higher frequency and amount of alcohol you take. That is, the more the alcohol, the more you take the dose. So it's commoner. Then what we also say is that we are worried about hot drinks more. Those who take hot drinks, now the beverage alcohol taken in moderation, we may not worry so much about them, but the hot ones, the epeteshi, local gin and everything, is we know it is associated with alcohol, with glaucoma, and then it also worsens progression, we also talk about the volume of what you consume, the volume is also an important aspect of what you consume. And then those who take the one with high percentage of alcohol than the beverage ones. Some tend to, when they take maybe beverage alcohol, they tend to add Sprite, or to calm them down. But in all, for you, you are having this challenge. You've done surgery, your medication, and you feel your vision is not as you expect. Because the problem we have is that most times the patient wants a vision to improve, but the visions don't improve that same way you want it. Your vision may be maintained, and you're asking yourself, why the surgery? Now, the surgery for glaucoma is actually to protect what you have, because it's an irreversible disease. So for you, you're having this challenge. I would advise you can stay off alcohol for a long while until your vision stabilizes. For now, just avoid as much as you can. If you must take, there are also what we call fruit wines. You can take. Then ensure you don't take those ones with more than say 3% alcohol. So that you can just be yourself. For now, you're having a challenge. I think it is good for you, Mr. Ene, to avoid alcohol. Now, for those who have advanced glaucoma, if you can avoid alcohol, okay. As much as you can, do avoid it. For those who take palm wine too, you also be careful. Well, I would say a cup will not cost harm per day, but there's a tendency for them to consume more in a bit to forget their situation. So we will advise, be cautious. The other things you can drink that will not jeopardize your health. So at this time, if you are having challenge with your eyes, please just leave alcohol for now, until your eye has stabilized. Then you can see how much you will be allowed to take. I think so. Our ophthalmologists also help us in this regard. So for what we call our habit change, so that we change our habits in a way that will be helpful. So the other things that can make a man happy, not just alcohol. So those other parts we can also prioritize them and make a person happy. For now, Mr. Ene, I will advise you stay off alcohol for now until your eyes are stable. Thank you.
All right. We can take more calls. There was a call that came in while we were talking. Do call back so we can take your call. 0909 771 1009. We're talking about the aging eyes. And we've established the fact that the older you get, the more your eyes are likely going to begin to wane. That doesn't mean everybody who gets old will have glaucoma, but it means that we need to be conscious of our eyes as we get older. 0909 771 1009 or 0902 311 1009. Get your calls in. Let's find the answers to those questions that are disturbing you from an expert. 0704 550 2840 or 0909 771 1009. Hello, good morning. Hello, good morning.
Hello, good morning.
Yeah, good morning.
I'm Joe calling from Ogo.
You're welcome. Go ahead.
Okay. I'm a teacher. Okay, and I know that chalk particles have been affecting us somehow in our eyes, right?
Mm.
And I also have spent some time in my lab for some languages like a few weeks now. So I'm noticing that things far from me now is becoming somehow more clearer to me, from distance. So I don't know. In fact, I'm feeling disturbed anyway. So I want to come and see this doctor. I don't know where it is. I don't know its location. So I wouldn't want it to continue generating because I'm noticing that there's something wrong now somehow.
Okay, you live in Enugu, right?
Yes.
Okay. The eye specialist hospital is at 11 Churchview, opposite former Adoration, in GRA,
Behind Park Lane.
just behind Park Lane.
Okay. If it's some contact, I will know if it's available.
Yes, thank you.
Okay. I'll give it to you just before we're done.
It's all right.
Just keep listening.
Thank you. Yeah.
You're welcome. Hello, good morning.
Yeah, good morning, sir.
Good morning.
Good morning.
Yeah, Oshoko is my name. I'm calling from Oka.
All right, let's hear you.
You talked of early detection of glaucoma. Assuming it is detected early and treated, does it mean that the person will never have glaucoma again in his life? Thank you.
Okay, thank you so much.
I don't know whether you got my question.
Yes, I got it, sir.
Okay.
I got it.
Okay, let's take this so you can treat all of them at once. Hello, good morning. Hello? Move away from your radio. Hello? Hello, good morning.
Good morning.
Yeah, good morning. What's the name?
My name is Ndubi Opko.
WC, you're welcome. Go ahead.
Please, what somebody that due to glaucoma.
Your line
And
is
now-
breaking. Your line is breaking. It's going in and coming out.
I said, if somebody that is blind due to glaucoma, what will be the condition of the eye after a long time?
What will be the condition of the eye after a long time?
Okay, yes, we'll answer that
Yes.
question. Yes.
If the outlet of the water, the fluid, is completely blocked, what will it cause the eye?
Okay.
Okay, sir. We'll answer the question.
All right. Go ahead.
Okay, just to answer Ozioko from Oka. Now, glaucoma, like hypertension and diabetes, are not curable, but they are treatable. Now, if found on time, to God be the glory, the person is advised to accept the option of eye drops, laser, or surgery. Commonest thing that people accept is eye drops. Now, if the eye drops are administered and patient's pressures are normal, that means he's doing well. You know, he has what we call target pressure. That's the pressure they will bring the patient the pressure to, and we don't expect damage to the eyes. And now, if that is well maintained, it is maintained for life. So treatment will be for life. You know, even when you have done laser or surgery, you also need to regularly visit the hospital, because they over time may fail, and if they fail, we will recourse to another option of treatment. In essence, you don't need to go blind from glaucoma or become visually impaired. If found early, the person needs to be well taken care of. Now, if you are being given drugs, don't say if you go to hospital again, they will give you drugs. No, keep going to the hospital, because you are being evaluated by many parameters. Apart from what you see, they also check your visual field, they check your intraocular pressure, they also look at your retinal fiber layer. So that is why, if you are doing well and your pressures are well maintained and there's no damage, you also need to be well seen, and catered for. Now, the physics question is, for a blind eye from glaucoma, what will happen? Now, if a patient is already blind and stops medication, the pressure will build up to an extent that the patient becomes to have terrible headaches, ocular pain, and cannot sleep.
So blindness is not the end of the issue.
No. That blindness is not going to. It's not. It doesn't end there. Don't think because you are blind from glaucoma that is it. No. So you also need to come to the hospital for us to do what we call lasers. We need to burn off the ciliary body that produces the aqueous fluid, so that to reduce the pressure. because you will not have peace of mind. You will not be without pain except the pressure is brought low.
Okay, because of time, you can join our glaucoma WhatsApp channel. Send a glaucoma to 0810 435 8093 on WhatsApp so that you can be added and learn more about glaucoma. The number again is 0810 435 8093. Okay, that's the much we can do today. Thank you, Dr. Obinna. And until next week, we want to thank you for being part of the conversation.
Thank you so much. And our people, let's make hay while the sun shines. Dalanu.
Thank you so much.
There, Raider Land.